So many people experience breast pain. In fact, this is probably the most common symptom people come to see me for in breast clinics. And I completely understand. Breast pain for some can be really scary, and it may cause you to wonder if something more serious could be the cause of the pain. The thing is, many people experience breast pain but don't know what to do about it. They either ignore the symptoms or think of the worst possible scenarios. And so today, I'm going to explain the mistakes people make when they experience breast pain and what can be done to help. Hi, my name is Dr. Tasha and I'm a breast surgeon. So, the first mistake people make is not tracking your symptoms. If you are premenopausal, it is not unusual to experience breast pain just before your period starts. A week or so before, you may find that your breasts hurt a little, you may feel a little bit heavy, swollen or sensitive. And these symptoms may last for a few days and they can be quite severe for some. Once your period starts, however, these symptoms usually improve. They may not go away straight away, but perhaps within a few days, the symptoms usually resolve, and they usually resolve completely. So this is called cyclical breast pain, and it is very normal. The thing is, you won't know that this is the case unless you track your symptoms. So being mindful of when your symptoms happen can be really useful and reassuring. So what you need to do is really just record when your symptoms start and when they end. If it coincides with the start of your period, then that type of breast pain is normal, and it's usually hormonally influenced. The other type of breast pain is called non-cyclical pain, and this pain actually happens outside the normal menstrual cycle. Again, by tracking your symptoms, you will also find out and see when these symptoms actually occur. If there's no rhyme or reason and that your breast pain just happens whenever, then this is non-cyclical breast pain. The second mistake people make when experiencing breast pain is not doing anything to help alleviate the symptoms. So just hear me out here. I know many people don't like to take pain relief. And the reason that's given is that, pain relief kind of masks the symptoms. But what I say to people is that if you have pain that is really causing you discomfort, then you should do something to alleviate that pain. For breast pain specifically, instead of taking painkillers orally, you can take a topical non-steroidal anti-inflammatory gel and apply onto the breast around the area where it hurts. This is a very targeted way of targeting discomfort. And if there's a degree of inflammation around, then a non-steroidal cream like ibuprofen, for example, can really work well. The other thing you can do is providing better support to the breast, and this can really be helpful. Many of us are wearing bras that are not providing full support to the breast. They're either too loose or too tight. And, we all do it, right? We go to the laundry department in a department store, pick a few nice looking bras, try them on and hope for the best. The truth is, unless you've had a bra fitting, you may be wearing a bra that isn't fully up to scratch. So if you haven't done so yet, do consider going for a proper bra fitting. Another mistake you may be making is you're poking and prodding the breast when the pain is present. So what you should be doing is actually examining the breast with the flat of your fingers. And I've actually made a video teaching you the correct way to examine your breast, and I will leave the link below, so you should check it out if you haven't done so yet. By the way, if you're enjoying this video, do reach out on social media. I'm at Dr. Tasha G. It would be great to connect and let me know your thoughts. Another mistake people make when experiencing breast pain is they think of the worst case scenario. I have breast pain and therefore I must have cancer. And as I mentioned before, breast pain is very common. Most women will experience breast pain at some point in their lifetime, and it usually does affect one breast. It's not uncommon for that to happen. Breast pain as a symptom in the absence of any other breast symptoms is unlikely to be breast cancer. The thing is, patients coming to clinic with any symptom will get a physical examination and scans. So an incidental cancer may be diagnosed during the clinic visit that was actually driven because of the pain, rather than the pain being caused by the cancer, if that makes sense. In addition, if the pain comes and goes, this is usually nothing to worry about. And so going back to the first point I made about mistakes people make, if you don't track your symptoms, you may not realize that the pain actually comes and goes depending on your cycle, and therefore it's nothing to worry about. So I hope this has been helpful, and I will see you in the next episode. Take care.